This video is for educational and informational purposes only. The content is based on personal experiences and is not medical advice. Always consult a qualified healthcare professional for personalized medical guidance.
They say cancer is a genetic disease. It's a very complicated disease. That's bullshit. I have the science. I publish these papers in top medical journals. If people want to live, they'll know about it.
Professor Thomas Seyfried is a world-renowned expert in cancer and a best-selling author of Cancer as a Metabolic Disease.
He has a revolutionary treatment for cancer that even your doctor doesn't know.
We have 1,700 people a day dying in the United States from cancer, and we have people dying from cancer in all countries around the world. Yeah, you can have cancer, but if you know how to manage it, it doesn't become a death sentence. Yeah, well, we had Pablo Kelly.
My name is Pablo Kelly, and when I was about 24, I was diagnosed with a grade 4 glioblastoma multiform brain tumor. I was given 6 to 9 months talking to the oncologist. I declined standard of care.
With 2.5 years of metabolic therapy, voila, the tumor was operable. And the same thing can be with breast cancer, prostate cancer, colon cancer. They all can be managed quite effectively with metabolic therapy. The high-fat diet is designed to keep your mitochondria healthy. If your mitochondria remain healthy, you're not going to get cancer. It's not like, oh, let me go out and eat a tub of lard. Let the GKI, the glucose-ketone index, tell you what you can and cannot eat. And we know we kill cancer cells when we have a GKI 2.0 and below. Wait till the world knows about this. Everybody's going to be jumping on metabolic therapy. Where are you going? Well, it depends on how they live their life. Some people never get cancer. Doesn't happen to everybody. I mean, we have a lot of centurions that are over 100 years old that have never gotten cancer. Madame Clement, the oldest woman that ever existed on the planet, 122 years of age, drank wine and smoked cigarettes until she was 119. She never got cancer. So not everybody gets cancer. But I think what we're doing to ourselves today puts a lot of people at risk for cancer. I think that what we're seeing is a sedentary lifestyle where we're eating large amounts of highly processed carbohydrates. We're not exercising like we should, and we're under mental stress, emotional stress, poor sleep, loneliness, microchemicals, forever chemicals and microplastics. I think when you put all that together, we're seeing more and more younger people getting cancer for sure. And the number of people getting cancer is increasing, and the number of people dying from cancer is increasing. So yeah, it's not a good picture, and will not likely get better until people realize that cancer is a mitochondrial metabolic disease that can be easily managed by maintaining mitochondrial health, which is doing the opposite of all the things that I just said. Well, I think if you abuse your body, it certainly could be. It's hard to get cancer. Cancer is very difficult to get. If you try to give cancer to mice or monkeys and things like this, it's very hard. There was one study where they used monkeys from South America. I think they were New World monkeys of some sort. And they try to give these monkeys cancer by rubbing carcinogen on their arms and having them eat it and drink it and feed it to them. And in 10 years, only one of the 50 monkeys got cancer because they were in their own diet and lifestyle. The problem is that if you took the monkey and gave him all the highly processed crap that we eat, and then had a panther walk around his cage, putting the fear of God into him every day, freaking him out, no exercise, eating crap foods, the monkeys may have gotten pancreatic cancer, colon cancer. There's never been a documented case of breast cancer in a female chimpanzee, and they're almost the same genetically as we are. So what's the chimp doing that we're not doing? He's not eating the crap food that we eat. He's doing what he knows. You got to change these animals' behavior. You got to put them in a radically different environment, and just give them what they love to eat, poorly nutritious foods in large quantities, right? So if you gave elephants don't get cancer. They haven't found elephants with cancer. But how many jelly donuts would you have to feed an elephant before before he would get pancreatitis and pancreatic cancer. I mean, dozens and dozens. And he would love it. I mean, it wouldn't be like, oh, they would say, oh, don't do that. It's harmful to the elephant. Well, we're doing it to ourselves every day in almost every country. We're not exercising. We're eating crap food. It puts us at risk for not only cancer, it puts us at risk for all kinds of chronic diseases. So all these chronic diseases, cancer included, are all the result of dysfunctional mitochondria in the cell. The mitochondria, the energy-generating organelle in our cells, becomes corrupted, leading to chronic diseases and cancer. Yes, absolutely. Even Otto Warburg said that. Most cancer is, in our Paleolithic ancestors, cancer was extremely rare. How do we know? Because we have people that live in tribes and according to traditional ways, and cancer was extremely rare when these people were evaluated for cancer. You had different physicians and humanitarians that would go around and look at Inuit populations, African populations, when they were living according to their ways. Albert Schweitzer certainly did look for cancer among African tribes. He didn't find any. Very rare. He even looked for thousands. What's weird? What's going on? As soon as the great Western diet and lifestyle enter into the society, you get all kinds of cancers, cardiovascular disease, type 2 diabetes, obesity. You get all the great wonders of our technological advances in food technology. And you have to do that. You have to abuse your body doing this for decades. You don't usually, eat a pizza and the next day wake up with a big tumor on your colon. It's usually an abusive series of behaviors, all culminating together with chemicals in the environment, all culminating in some form of dysregulated cell growth, which is cancer in some organ of the body. Well, I mean, we published this in many papers. The definition of the disorder is called cell division out of control. Okay. Well, the cells in your liver, kidney, colon, spleen, breast, brain, they're all there. They're all doing their metabolically designed, metabolically homeostatic condition. What would make one of these cells start to grow in a dysregulated way? And that we have clearly shown that it is chronic disruption of the ability of the cell to use oxygen to obtain energy. So one of the differences between a cancer cell and a normal cell, non-cancerous cell, is the way the cell uses energy. All of the cells in our body, with the exception of erythrocytes and perhaps a few others, we breathe energy, we breathe oxygen, and the oxygen serves as an acceptor for electrons through the mitochondrial electron transport chain in the organelle called the mitochondria. And we can generate tremendous amounts of energy because without energy, nothing can survive. So energy then becomes the key feature of life. Interestingly enough, all of our cells, for the most part, are using oxygen to generate energy. In cancer, the oxygen that is consumed by the cancer cell is not used for producing sufficient energy from oxidative phosphorylation. It actually produces reactive oxygen species, ROS, which are carcinogenic and mutagenic. So the cancer cell is throwing out reactive carcinogens and mutagens that damage other parts of the cell, causing mutations in the nucleus. Of course, many cancer cells have mutations in the nucleus, but these are not the cause. These are the effects of the disturbed energy metabolism in the mitochondria. And the fuel that's driving the dysregulated growth now becomes fuels that don't need oxygen. So that's called fermentation, energy without oxygen. And the two fuels that we and others have identified are the sugar glucose and the amino acid glutamine, which is a very highly abundant amino acid in our bloodstream. Our big finding and discovery to clear up the mess was that this amino acid can also be fermented, can also generate energy in the absence of oxygen in the organelle, this mitochondria. So this was it's a big discovery, but a lot of people simply can't understand it yet, because they look at the mitochondria and they say, "Oh, look at all the ATP coming out of there. It's taking in oxygen, and energy called ATP is coming out." And they say, "See, it's perfectly similar to a normal cell." But the issue is the normal cell is using the oxygen to make ATP. The cancer cell is using the oxygen to make carcinogens and mutagens, and they're using other fuels to ferment, which is energy without oxygen. And the waste products of fermentation are lactic acid and succinic acid, and the cancer cell is dumping those out, clearly telling us in no uncertain terms what it is doing to stay alive. So we know that, and they grow in the absence of oxygen. So clearly, cancer cells do not use oxygen where normal cells use oxygen. So that tells us the foundational difference between a cancer cell and a normal cell, and they can't grow without the glucose-glutamine, and they can't switch to fatty acids or ketone bodies like normal cells can. So the whole cancer thing is extremely simple in how to kill cancer and manage cancer, to both prevent and manage it. So why does the field not know this, and why do they not act upon it? And there's a lot of reasons for that. And one of the reasons is they think cancer is a genetic disease. So they keep chasing mutations and hunting and trying to target mutations or the effects of mutations, which are mostly irrelevant. And as the result of chasing and targeting things that are not relevant to the disease, we have 1,700 people a day dying in the United States from cancer, which is 70 an hour. And we have people dying from cancer in all countries around the world in high numbers. And none of these people, none of these studies are targeting the glucose and glutamine to stop the proliferation of these dysregulated cells and transitioning the body to fatty acids and ketones while you're simultaneously targeting the fermentable fuels. You can go to any oncology clinic in the world and describe what I just said, and they look at you like a deer in the headlight. They have no clue. They've never heard what I said. And then if they want to act upon this, the standard of care prevents them from acting upon this, which is the change of radiation and chemo and a lot of the crazy things they're doing to these people. They say, well, geez, why don't we just target glucose and glutamine while transitioning the body to nutritional ketosis? Oh, no, we can't do that. I said, why? Well, we haven't heard why. We'd have heard something about, no, you're not going to hear anything. In medical school, you're told the cancer is a genetic disease. Therefore, you have to do immunotherapies and all these other kinds of things. And one of the things that's really remarkable, how come we don't make any advance? Well, it's hard to make an advance when the entire world thinks it's something other than what it is. And that explains why no country, whether it's Australia, England, Germany, France, the UK, United States, China, we're all doing the same thing. You go there and everywhere they use, we have to surgically debulk, we have to give you poisonous chemicals and radiation and immunotherapies or something like this. And a lot of people are killed by the treatments. And a lot of people, if they do survive the treatment, they're damaged in many different ways. Their organs are damaged from radiation. And radiation is not healthy. Let me tell you, it's not a healthy way to get, no one goes out and gets nuked or poisoned to become healthy. And yet we're doing this to people with cancer. It's nuts. Doesn't make any sense. And they don't make any sense because if you go to the National Institutes of Health, they say cancer is a genetic disease. It's a very complicated disease. Hundreds of different kinds of cats. Bullshit. They're all the same. We showed that. Every major cancer is dependent on glucose and glutamine and can't burn fatty acids or ketone bodies. They're all the same. Colon, breast cancer, and they're all basically have the same metabolic problem. Yeah, they all have dysfunctional mitochondria and are dependent on a fermentation metabolism to grow. So, and they acidify the microenvironment with the waste products of the fermentation metabolism. It's over and over again. Every major cancer has insufficient oxidative phosphorylation coupled to substrate level phos, which is the scientific terminology that I'm using. Oxidative phosphorylation replaced largely by substrate level phosphorylation. This is an ancient pathway of energy before oxygen came into the atmosphere 2.5 billion years ago. all the cells that existed on the planet were fermenters. These cancer cells are simply falling back on these ancient pathways that are driven by glucose and glutamine to get energy. So we have clearly defined the fuels driving the dysregulated growth. And what you do is you target those fuels because the normal cells in the body can transition over to fatty acids and ketone bodies, and the tumor cells can't because their mitochondria are dysfunctional. How is that so complicated? But I might as well be speaking in hieroglyphics or drawing things because nobody can seem to understand it, except when the people start using this therapy to manage their cancer. And the doctors are always miffed. Oh, I didn't know you were going to survive so long. Oh, what are you doing? And then when you tell them what they're doing, a lot of times the physicians say, I don't know what you're doing, but just keep doing it. Yeah, well, we had Pablo Kelly who passed away. He was a glioblastoma patient who was initially diagnosed with an inoperable glioblastoma in 2014. And he reached out to me, and he didn't want any surgery at first, radiation or chemo, just did metabolic therapy. And his tumor, well, they were surprised. It didn't grow very fast. It started to slow down. And then after 2.5 years, he had it cut out, debulked. And then he thought he was free of the cancer. But it never got completely out, and it started to grow again, but very, very slowly. And he had it debulked a second time. And then after several more years, he had it debulked a third time, never taking radiation or chemo. And then we spoke to him a week before he died, and we were laughing and at the fact that he had 3 debulking surgeries to move what was originally described as an inoperable tumor. So we were laughing about that. How you have you're diagnosed with an inoperable tumor that was going to kill you in 9 months if you did not have radiation and chemo, because the tumor could not be operated on. But with 2.5 years of metabolic therapy, voila, the tumor was operable, cut out, but it grew back. So he was never cured. But on the 4th debulking surgery, which was a week after we spoke to him, he was in good spirits. He got married, had 2 children since the original diagnosis. So he died in 2024, last Labor Day, I guess, last September, from a cerebral hemorrhage as the result of a 4th debulking surgery. He died 12 hours after the cerebral hemorrhage. If he didn't have that last debulking surgery, which was only to get rid of some tiny residual piece, he probably would have been still alive with us today. But 10 years with a glioblastoma is unheard of. People say, well, he's only a fluke, an N of 1. Oh, yeah, well, why don't you see if we can get more? Oh, no, we have to do radiation and chemo. Well, that's what he didn't do. That's what he did not do. But our recent paper out of Greece, now that's a bigger study because that used 18 people, half of whom did a Mediterranean, calorie-restricted Mediterranean diet. But they were irradiated, and they did have temozolomide. They did have standard of care, which itself puts the patient at incredible risk for death. But they were unable to convince the Institutional Review Board not to irradiate and use poisonous chemicals. So they had to do that because it's locked, like it's written in granite everywhere. So anyway, they did use a calorie, according to our procedures, the glucose-ketone index calculator, and they used a calorie-restricted Mediterranean ketogenic diet, which is published, just came out, so you can read it in Frontiers in Nutrition. And of the people that maintained, and the diet wasn't bad. It was sardines and salmon, olive oil, and some avocado, and maybe some other stuff, but not unpalatable for sure. And 8 people followed that, and 6 people, followed that, and 10 people didn't. And the reason why they didn't follow it, it was like pressure from the family, and some people felt that they already had radiation and chemo, they didn't want to do a diet. But anyway, the guys that followed the diet, 4 of the 6 survived beyond 3 years. And the guys who didn't do the diet, only 1 survived to 3 years. So clearly a striking difference in overall survival doing metabolic therapy. And that was with standard of care. Now, my hypothesis, and I've told the oncology world to prove me wrong. I said, if you didn't do radiation and toxic poison, surgery for sure, we don't rule that out. We can shrink down those tumors if we have a watchful waiting period, and then the surgeon will debulk or take out a much greater part of the tumor and then transition the people back over to metabolic therapy like Pablo Kelly. But now we know we can target glutamine with parasite medications, which makes it even more powerful. So we think we can keep cancer patients alive 2, 3, 4 times longer without toxicity. Brain cancer, glioblastoma patients, much longer at a much higher quality of life. But nobody wants to touch that with a 10-foot pole. They want to stick to the crazy stuff they've been doing for 100 years. We haven't made any advance in glioblastoma in 100 years. And we want to move them forward. We want to move it forward. But there's a lot of reasons why, and a lot of it has nothing to do with the science. The science tells us exactly what to do. The tumor cells are telling us exactly what they're doing to stay alive. And they're telling us that if we do this and that, we will kill them. But what the tumor cells are telling us seems to fall on the deaf ears of the establishment. They want to continue to do the stuff they've been doing for decades without any major advance. And we're saying, no, we can keep these guys alive a lot longer. And the same thing can be with breast cancer, prostate cancer, colon cancer. They all can be managed quite effectively with metabolic therapy. But what we do is we do horrible things to people. We poison and irradiate them to make them healthy. And a lot of times this doesn't work. And the new immunotherapies, Keytruda, Opdivo, Avastin, all these kinds of things, they're not working to a great extent. Yes, they are working on some people. I don't want to say that they're not working. You do get about 20% of people that do really well. Then you get 60% of people where doesn't do anything. But then there's a term called hyperprogressive disease, where the therapy will kill you before the cancer. It's called hyperprogressive disease. And you get about 16 to 20% of these folks. So, why would you treat anyone with a remote chance that it will kill you? But what's another thing which we're finding is if you do metabolic therapy, the standard of care can do better as well. So, and that's what the Greek study was telling us. But if we didn't do standard of care, or we used modified parts of the standard of care, we can keep people alive so much longer, especially when they're first diagnosed. A lot of people come to me after they've been brutalized by the system and say, I want to do metabolic therapy. Well, they're gaunt. They look like death warmed over. They're all bald. And I mean, man, it's tough to bring somebody back from that kind of abuse. But when you're first diagnosed, usually you're pretty healthy in a lot of cases. You're not so bad off. You do really remarkably well when you institute metabolic therapy up front. And then if you need radiation and chemo, you can always do that. Nobody's preventing you, but why would you do it up front and make yourself brutalized make your body unhealthy by poison and radiation are not healthy for the body?